Endocrine system. Overview. E1. Introduction. The endocrine system is a collection of glands that produce and secrete hormones directly into the bloodstream to regulate various body functions, such as metabolism, growth, development, mood, and homeostasis. It works closely with the nervous system but uses chemical signaling instead of electrical impulses. 2. Major endocrine glands and their hormones. Gland, hormones secreted. Hypothalamus, TRH, CRH, GnRH, GRH, somatostatin, dopamine. Regulates pituitary gland, links nervous and endocrine systems. Anterior, posterior. GH, TSH, ACTH, LH, FSH, PRL. Oxytocin, ADH, controls growth, thyroid, adrenal cortex, reproduction, lactation. Water balance, uterine contractions. Thyroid, T3, T4, calcitonin, regulates metabolism, growth, calcium balance. PTH, parathyroid hormone, increases blood calcium levels. Adrenal glands, cortex, medulla, cortisol, aldosterone, androgens, epinephrine, norepinephrine, stress response, salt balance, fight or flight. Pancreas, islets of Langerhans, insulin, glucagon, somatostatin, regulates blood glucose levels. Pineal gland, melatonin, regulates sleep-wake cycle. Gonads, testes, ovaries, testosterone, estrogen, progesterone. Controls sexual development and reproduction. Thymus, active in childhood. Thymosins, maturation of T lymphocytes, immune function. NanoSha3, mechanism of hormone action. Endocrine signaling. Hormones are released into the bloodstream and act on distant target organs. Hormone receptors. Target cells have specific receptors for hormones. Peptide hormones, e.g. insulin, bind to surface receptors, use second messengers like CAMP. Steroid hormones, e.g. cortisol, pass through the membrane and bind to intracellular receptors, affecting gene transcription. Negative feedback. The most common regulatory mechanism prevents overproduction of hormones. Example, high levels of T3, T4 inhibit TSH and TRH secretion. Positive feedback, rare, amplifies the response. Example, oxytocin during childbirth increases uterine contractions. Not 5. Integration with the nervous system. The hypothalamus acts as the central coordinator, receiving signals from the brain and releasing hormones that regulate the pituitary gland, which in turn controls other endocrine glands. 6. Key functions of the endocrine system. Metabolism regulation, thyroid hormones, insulin, growth and development, GH, sex hormones. Reproduction, LH, FSH, estrogen, testosterone. Water and electrolyte balance, ADH, aldosterone. Stress response, cortisol, epinephrine. Sleep-wake cycles, melatonin. NanoSh7, disorders of the endocrine system. Dishormone involved in aldosterone, diabetes mellitus, insulin, hyperglycemia, hyperthyroidism, T3, T4, increased metabolism, weight loss, hypothyroidism, T3, T4, slowed metabolism, weight gain, Addison's disease, cortisol, aldosterone, fatigue, low blood pressure, Cushing's syndrome, cortisol, weight gain, high blood sugar, acromegaly, GH, excessive growth in adults. 8. Conclusion. The endocrine system is vital for maintaining internal balance, homeostasis, and regulating a vast range of bodily functions. Its precise coordination with the nervous system ensures the body can respond effectively to internal and external stimuli. Pineal gland, functions and hormones. Overview. The pineal gland is a small, pea-shaped endocrine gland located deep in the center of the brain, between the two hemispheres, in a groove where the two halves of the thalamus join. It is also known as the third eye due to its role in sensing light and darkness. Hormones secreted by pineal gland. Hormone. Function. Melatonin regulates circadian rhythm, sleep-wake cycle. Controls seasonal biological rhythms, e.g. breeding in animals. Has antioxidant properties. Modulates immune response. Functions of the pineal gland. Function. Details. 1. Regulation of sleep-wake cycle. Melatonin secretion increases in darkness and decreases in light. Helps induce sleep at night and promotes wakefulness during the day. 2. Biological clock synchronization. Maintains daily rhythms, circadian, and seasonal rhythms, circannual. Coordinates physiological functions like temperature, appetite, hormone release. Antioxidant activity. Melatonin acts as a free radical scavenger, protecting cells from oxidative stress. 4. Modulation of reproductive hormones. Melatonin can influence the onset of puberty by inhibiting gonadotropin-releasing hormone, GnRH, during early childhood. 5. Immune regulation. Supports immune system by enhancing T-cell production and modulating inflammation. Melatonin secretion pattern. Increased at night. Stimulated by darkness via signals from the suprachiasmatic nucleus of the hypothalamus. Decreased in daylight. Light exposure inhibits melatonin production. Clinical relevance. Condition, discrete disorder. Sleep disorders. Low melatonin linked to insomnia and disrupted circadian rhythm. Jet lag. Melatonin supplements may help reset the internal clock after long flights. Seasonal affective disorder. Altered melatonin rhythms contribute to winter depression. Precocious puberty. Pineal tumors or damage can cause early onset of puberty due to loss of melatonin's inhibitory effect on GnRH. Pituitary gland. Functions and hormones. Overview. The pituitary gland, often called the master gland, is a small pea-sized gland located at the base of the brain, just below the hypothalamus. It is divided into two main parts: anterior pituitary, adenohypophysis, posterior pituitary, neurohypophysis. It regulates many vital body functions by releasing hormones that control other endocrine glands. Hormones and functions. Anterior pituitary hormones, adenohypophysis, hormone, major function. Major function? GH, growth hormone, stimulates growth of bones, muscles, and tissues, regulates metabolism. TSH, thyroid stimulating hormone, stimulates thyroid gland to produce T3 and T4, regulates metabolism. ACTH, adrenocorticotropic hormone, stimulates adrenal cortex to secrete cortisol, stress hormone. FSH, follicle stimulating hormone, in females, stimulates ovarian follicle growth and estrogen production. In males, stimulates spermatogenesis. LH, luteinizing hormone, in females, triggers ovulation and progesterone secretion. In males, stimulates testosterone production. PRL, prolactin, stimulates milk production in mammary glands after childbirth. EMISH, in some species, less active in humans, melanocyte-stimulating hormone, influences skin pigmentation, mainly active in lower animals and during fetal development. Posterior pituitary hormones, neurohypophysis, full name, major function, ADH, antidiuretic hormone, vasopressin, promotes water reabsorption in kidneys, helps regulate blood pressure. Oxytocin, stimulates uterine contractions during childbirth and milk ejection during breastfeeding, plays a role in bonding and social behavior. Note, the posterior pituitary does not synthesize hormones. It stores and releases hormones produced by the hypothalamus. Functions of the pituitary gland. Function in bonding and social behavior. 1. Growth regulation, via GH, stimulates overall body growth. 2. Metabolism control, TSH, stimulates the thyroid to regulate metabolic rate. 3. Stress response, ACTH controls adrenal cortisol release for stress management. 4. Reproductive function, FSH and LH regulate menstrual cycle, ovulation, sperm production, and sex hormone levels. 5. Lactation, prolactin promotes milk synthesis in mothers. 6. Water electrolyte balance, ADH prevents water loss via urine and maintains blood pressure. Labor and delivery, oxytocin triggers uterine contractions and assists in milk letdown. Clinical relevance, examples, disorder symptoms, gigantism, acromegaly. Excess GH, abnormally large growth in children or adults. Dwarfism, GH deficiency, short stature, delayed growth. Diabetes insipidus, ADH deficiency, excessive urination, dehydration. Hyperprolactinemia, excess PRL. Infertility, galactorrhea, menstrual irregularities. Thyroid gland, functions and hormones. Overview. The thyroid gland is a butterfly-shaped endocrine gland located in the front of the neck, just below the Adam's apple. It plays a vital role in regulating the body's metabolism, growth, and development through the secretion of thyroid hormones. Hormones secreted by the thyroid gland. Produced by function, triiodothyronine, follicular cells, regulates metabolism, increases oxygen consumption, stimulates protein synthesis. T4, thyroxine, tetraiodothyronine, follicular cells, converted to T3 in tissues, maintains basal metabolic rate, BMR, influences heart rate, temperature, and brain development. Calcitonin, parafollicular, C cells, lowers blood calcium levels. Inhibits bone resorption, osteoclast activity, promotes calcium deposition in bones. Note, T3 is the active form. T4 is more abundant, but converted to T3 in target tissues. Functions of the thyroid gland. Details. 1. Metabolism regulation. T3 and T4 increase metabolic rate, heat production, and energy utilization. Growth and development. Essential for normal growth in children. Promotes development of brain and nervous system. Cardiovascular function. Increases heart rate and cardiac output. 4. Nervous system activity. Enhances alertness, reflexes, and neural development. 5. Thermoregulation. Maintains body temperature by increasing oxygen consumption in cells. 6. Calcium homeostasis. Calcitonin helps lower elevated blood calcium levels, antagonistic to parathyroid hormone. Regulation of thyroid hormones. Hypothalamus releases TRH, thyrotropin-releasing hormone. Pituitary gland releases TSH, thyroid-stimulating hormone. Thyroid gland produces T3 and T4. Negative feedback loop. High T3, T4 levels inhibit TRH and TSH production. Common thyroid disorders. Disorder hormone imbalance. Hypothyroidism, e.g. Hashimoto's thyroiditis, low T3, T4, fatigue, weight gain, cold intolerance, depression, slow heart rate. Hyperthyroidism, e.g. T4, weight loss, heat intolerance, anxiety, tremors, increased heart rate. Goiter, iodine deficiency, enlarged thyroid gland. Thyroid nodules cancer, variable, lump in neck, hoarseness, sometimes hormone changes. Parathyroid glands, functions, and hormones. Overview. The parathyroid glands are 4 small glands, sometimes more, located behind the thyroid gland in the neck. Despite their close proximity to the thyroid, their function is entirely different. They play a critical role in calcium and phosphate balance in the body. Hormones secreted by the parathyroid glands. Hormone, full name, function. PTH, parathyroid hormone, increases blood calcium levels, decreases blood phosphate levels, regulates calcium absorption, resorption, and reabsorption. Functions of parathyroid hormone, action organ. Bones. Stimulates osteoclasts to break down bone tissue, releasing calcium into the blood. Kidneys. Increases calcium reabsorption in renal tubules, less calcium lost in urine. Decreases phosphate reabsorption, promoting phosphate excretion. Intestines. Indirectly increases calcium absorption by activating vitamin D, calcitriol, in the kidneys. Regulation of PTH secretion. Low blood calcium stimulates PTH release. High blood calcium inhibits PTH release. Negative feedback. Clinical relevance. Disorder parathyroidism, hyperparathyroidism, overactive parathyroid glands, high blood calcium, hypercalcemia, bone weakening, kidney stones, fatigue, underactive parathyroid glands, e.g. after thyroid surgery, low blood calcium, hypocalcemia, muscle cramps, tetany, seizures. And mnemonic to remember PTH actions. PTH equals put the calcium high, bone, breaks it down to release CA acromide. Kidneys reabsorb CA fragments, excretes phosphate. Intestines indirectly absorbs more CA via vitamin D. Thymus gland functions and hormones. Overview. The thymus is a specialized lymphoid and endocrine gland located in the upper anterior chest, behind the sternum and between the lungs. It is larger in infants and children and gradually shrinks after puberty, a process called involution. Despite its small size in adults, it plays a crucial role in immune system development during early life. Hormones secreted by the thymus. Thymosin stimulates the maturation of T lymphocytes, T cells, which are essential for adaptive immunity. Thymopoietin promotes the differentiation and proliferation of T cell precursors. Thymulin enhances T cell function and modulates immune responses. These hormones help convert immature lymphocytes from bone marrow into immunocompetent T cells. Functions of the thymus gland. Details. Helps T cell maturation, converts immature T cells into functional T lymphocytes, especially helper, cytotoxic, and regulatory T cells. Immunological self-tolerance helps T cells learn to distinguish self from non-self, preventing autoimmune diseases. Hormonal support for immunity secretes thymic hormones, e.g. thymosin, that regulate immune cell activity. Childhood immune development, most active during childhood, establishing the immune system's long-term defense capabilities. Involution of the thymus. After puberty, the thymus shrinks and becomes replaced by fat and connective tissue. However, some thymic tissue may remain functional throughout life. Clinical relevance, condition, description. DiGeorge syndrome, congenital absence or underdevelopment of thymus, leads to severe T-cell immunodeficiency. Thymoma, tumor of thymus gland, may be associated with myasthenia gravis. Thymic hyperplasia, enlargement of the thymus, can occur in autoimmune conditions. Summary chart. Location: mediastinum, behind sternum. Primary hormones: thymosin, thymopoietin, thymulin. Main function: maturation and differentiation of T cells. Activity peak: childhood and adolescence. Involution: shrinks with age, but immune memory remains. Pancreas, functions and hormones. Overview. The pancreas is a dual-function gland located behind the stomach. It performs both exocrine and endocrine functions. Exocrine function secretes digestive enzymes into the small intestine. Endocrine function secretes hormones into the bloodstream to regulate blood glucose levels. Endocrine part of the pancreas. The endocrine portion consists of clusters of cells called the islets of Langerhans, which contain several hormone-producing cell types. Cell type, hormone, function. The endocrine cells, glucagon, raises blood glucose levels by stimulating glycogenolysis and gluconeogenesis in the liver. Beta cells, insulin, lowers blood glucose by promoting glucose uptake into cells and stimulating glycogen, fat, and protein synthesis. Delta cells, somatostatin, inhibits secretion of both insulin and glucagon, slows digestion and nutrient absorption. PP cells, F cells, pancreatic polypeptide, regulates exocrine and endocrine pancreatic secretions and appetite. Main endocrine hormones and their actions. Hormone, effect on blood glucose, other actions: stimulates glucose release. Insulin, beta cells, lowers glucose, promotes storage of glucose, fat, and amino acids. Glucagon, alpha cells, raises glucose, stimulates liver glucose release. Somatostatin, delta cells, neutral, inhibits GI hormone release and slows digestion. Pancreatic polypeptide, PP cells, neutral, controls appetite and regulates digestive secretion. Exocrine function of the pancreas, component, function, digestive enzymes, amylase, lipase, proteases, break down carbohydrates, fats, and proteins in the small intestine. Bicarbonate, neutralizes stomach acid in the duodenum. Regulation of pancreatic hormones. High blood glucose stimulates insulin release. Low blood glucose stimulates glucagon release. Somatostatin provides feedback inhibition of both. Clinical conditions. Condition: cause, effect. Diabetes mellitus type 1, autoimmune destruction of beta cells, no insulin, hyperglycemia. Diabetes mellitus type 2, insulin resistance, impaired glucose uptake, hypoglycemia, excess insulin or fasting, low blood glucitis. Inflammation of pancreas affects both endocrine and exocrine functions. Aspect, detailed, height location, behind stomach and abdomen, endocrine function, blood glucose regulation, main hormones, insulin, glucagon, somatostatin, pancreatic polypeptide, exocrine function, digestion via enzyme secretion, key disorders, diabetes mellitus, pancreatitis. Thank you. Have a nice day.